The technology of 3D printers is fast changing how we do many things in our lives, and it's certainly affecting how medicine is practiced too. At the Jump Trading Simulation Center, they're using them in an innovative way to create surgical planning tools. Living Well's Ben Dwyer shows us how this groundbreaking process is developing right here in Peoria and being recognized across the country.
Here at the Jump Trading Simulation Center, the staff use all kinds of simulators for medical training, but they always felt there was room for improvement.
And so we've been developing simulators that are anatomically correct for the students to practice with, and that just enhances the simulation, brings it to another level.
To accomplish that, Sabine Admani used this 3D printer, which can take data from CT and MRI scans and render an exact life-size copy of the corresponding body part, which really does add a new dimension to the simulator, like this one used for a windpipe procedure.
And so what we did is take a patient CT scan and create a model from that. So this model has a place where you can place the trachea. There are certain procedures that you need to be as close to accurate as possible to teach well, and this is one of them.
Not only did the 3D printer help design models more true to life, but also did so at an affordable price. But then came a flash of inspiration to use the technology in an entirely different way.
And one thing led to the next.
We realized that there was another application for it, and that's the surgical planning tool aspect.
Doctors like cardiologist Matthew Bramlett quickly grasped that the very scans used to evaluate a patient before surgery would provide more crucial information if actually printed out in 3 dimensions.
So any tool that allows me to be more accurate in what I'm telling the surgeon is going to be highly valuable. You can tell the difference in color.
Soon, doctors teamed up with bioengineers to print out models of patients' hearts to give surgeons a preview of what they'd actually encounter in the operating room.
To sort of look under the hood, so to speak, and see what is going on. Imagine just instead of telling the surgeon this is what the defect is, handing him a heart and saying, here is the defect.
And doctors learned to their amazement that 3D models could sometimes even show things not visible in the scans that had produced them. And that special kind of insight recently enabled surgeons to successfully help a 3-year-old boy through a complex procedure.
And so by having the model in our hands and being able to actually visually and physically understand the anatomy better, we're able to provide a complete repair for this child's heart.
The groundbreaking work begun here for surgical planning is spreading across the country, and Jump is networking to share what they've accomplished, even creating a so-called library of hearts for others to study.
So we have some active collaborations with the Mayo Clinic, with Columbia, with Harvard. So really big name institutions are finding the benefit of what we have here in Peoria, which is engineers and clinicians working together.
So now Admani is busy making models to aid everything from facial reconstruction to spinal surgery. And she's excited to see the process evolving.
I think because we bought the printer with a different intention, it's really awesome to see it flourish in a different direction as well.
Ben Dwyer, WMBD 31 News.